And she is really a gem for our Parkinson's community and provides so much life information for us. So thank you, Sarah, for being with us today.
Thanks for joining,
Th-
Sarah.
Thank you both. It's wonderful to be here, and I'm excited to talk with you all today and share information. So, I'm going to talk about lifestyle changes that really have impact for how you feel every day. And I welcome questions and comments, and there'll be two places during the talk for some comments and questions, as well as at the end. So, I don't have any disclosures. And I want to really talk today about lifestyle changes that can improve everyday functioning and health. And we're going to really take a big picture look at health and wellness and look at things for both the body, the spirit, and the mind, as these things are all interrelated and very important. And I am borrowing this picture from my director, but I have to say we have all experienced unexpected life events in 2020 and have really had challenges to deal with. Um, and those have been extra compared to even what typical life is like. So we'll talk about that a little bit too. As we age, there's just an increased risk of health problems. And one thing that I noticed is that a lot of people around the time of retirement, kind of a lot of changes can occur physically, but they also have increased free time, but there's financial concerns and a transition from how to structure your day and time. And there can be changes in family supports and sort of who is available for help and resources. Parkinson's disease is commonly diagnosed in the late 50s and early 60s. So, right around this time, as Carl experienced, you can have young onset in your 30s, and you can have much later onset, even in your 70s or early 80s. But the typical age is around late 50s, early 60s. And it is a neurodegenerative disease and it's chronic. But the thing that's kind of even more challenging is it can be unpredictable at times. So sometimes a flare in symptoms can happen. It can be very hard to find out why that happened, and it can be hard to treat it, but it can also go away at the same time. So I've worked with people who've had sleep problems develop, but then those things have improved over time. So this is an illness similar to like multiple sclerosis or some other issues where you can't just treat your symptoms and kind of forget about them. It's something that can change. What you're dealing with can change, and really requires continual care. Parkinson's disease is caused by some loss of dopamine producing cells in the brain. And because of those changes, you're also more prone to increased anxiety and depression with changes in those neurotransmitters. You can also develop depression or anxiety due to adjustment to the illness or what changes it's causing in your life. And some people definitely have anxiety about wearing off or how their medicines are reacting and treating their symptoms. These things can occur in about 35 to 60% of people, but not everybody, but it is important to treat these. We know that particularly with depression, if it's untreated and significant, it can negatively impact the motor symptoms and vice versa. So it's not something that you want to ignore. And when I work with people, I'm really looking at lots of different factors that can influence how people are functioning from a cognitive perspective. So there's a lot of mood possible changes like stress and depression, anxiety. Apathy is a little different. So it's commonly thought of as a symptom of depression, but in Parkinson's, people can have apathy or lack of motivation and drive, even separate from having depression. So, in the absence of depression. And certainly, there can be a reaction or adjustment to illness. I've already brought up sleep problems. There can be fatigue, pain, appetite changes, medication side effects, all kinds of things. So one thing that I think is important to think about is sometimes people get into this habit, once diagnosed with Parkinson's, they're sort of bracing for the worst or always wondering what's coming next in a very negative, non hopeful view of the future. People can become increasingly isolated. They may be embarrassed about their symptoms or the tremor that can show, and then they kind of limit how much they're interacting with people, which in turn can make them feel more depressed. So that can make the motor symptoms worse and sort of become this really vicious circle. And that's something to work against. When you're focused on sort of um, concerns about the future and anxiety about the future, it really robs you of your present joy. So it actually doesn't help you necessarily prepare for any future issue that comes up, but it reduces your joy in the moment of today and actually reduces your resilience. Um, so when you can have a concern and use it to then, let's say, talk to your doctor about a concern or do something proactive, that's constructive. But when you just have sort of free range anxiety, what's going to happen, um, that can just kind of erode your mental health over time. The other thing about anxiety that I often tell people is it really fills whatever space you give it. So if you have a little bit of anxiety and don't treat it, it can definitely grow or worsen to other areas. We're going to talk about treatments for these things, but I wanted to kind of start talking about lifestyle choices that we make and how much they influence our mood and functioning. So you see here the picture of the feet up by the chair, on the chair with the TV on. And I have to say that when people tell me, I ask people what they do kind of every day to engage their mind, and they say, well, they watch TV. And I'm like, that doesn't count for anything, in my opinion. We're very much kind of in a zone when we watch TV, but not necessarily interacting or really learning and processing information at a deeper level, typically. But we can make choices where we exercise or join groups or have different kinds of activities that we do that are much more enriching for our emotional and physical health. So during the pandemic, I know we've all experienced just how challenging it is to not have some of those social outlets. It's not that we have to be social all the time, but whatever level we prefer and what works for us definitely has a role in our health. And with COVID, we've all had to restrict our social interactions significantly. And we've seen increase in diet changes and people gaining weight, but also alcohol sales going up. So people are kind of treating this stress and anxiety about COVID, but in ways that are very detrimental to health and mental health. Alcohol is a depressant, so over time, it's really going to increase how depressed you feel. And so when we think about coping choices, I think it's important to really focus on what actually can help maintain us and sustain us through hard times and good times. But you see here um, the picture of the Sheridan is for humor or movies that are funny and laughter. We have pets that can provide a lot of support emotionally. Massage is something that can be very helpful. And then the bottom images are, just social gatherings, playing cards, doing various things. And I think with the nicer weather now, especially during COVID, this kind of gives us more opportunities to be outside and in a safer venue, but still be able to get together with people to a certain degree. So one study that I did with a student, Sarah Griffin, was looking at sleep disturbance and loneliness and health outcomes. And so loneliness is associated as a risk factor for both morbidity and mortality. And sleep disturbance partially explains the relationship between loneliness and self-reported health. And this was in an 8-year sample of over 5,000 people. And so we see that these things can be interrelated, and sleep is a very important um, factor in terms of keeping your memory healthy. We know that during sleep, memories are consolidated or what we call laid down. So if you're having lots of interrupted sleep, your memory and attention are likely to be worse, but you're also likely to have more negative health outcomes. So, as far as optimizing your health, um, for social wellness, I really think it's important to connect with others, and you don't have to be a social butterfly, but sort of what social activity feels comfortable to you. Some people are more quiet and reserved, and you may find going to a class, like a gym class, where you interact with people, but there's a clear focus, what you're going to do to be a little less stressful, whereas other people kind of naturally connect with other people. Um, but certainly thinking about hobbies and classes, even volunteering that you can do, humor and comedy can be very helpful um, activities. And there's a lot of online classes right now in the time of COVID. It's not the same as in-person interactions, but it's at least something that we can do. So there's yoga for Parkinson's classes. Stanford has a nice website with exercise classes, and the APDA also has online exercise classes. And so you could Google and research for more, but there definitely are a lot of online classes that at least provide some avenue for social connection and physical activity. Therapy is also moved to more online formats. And I have to say, in my clinic, I never did telehealth therapy before. And I really struggled at first adjusting to it, but now I'm quite comfortable with it. And I think most of my patients really find that it works very well. Some I'd known for years, so we had a relationship, but others were new to me, and we still have done very well with it. The benefits of telehealth therapy is you're at home, there's no travel time, it's safe in this time of COVID. There's often reduced fees for copays, and it's very efficient. There's no checking into a building and having to get to a correct room and things like that. Um, Internet service and computer skills can be issues, but I think largely we've navigated those so they're not too prohibitive. But I would encourage you, if you're feeling like you do need more interaction and even want to make changes in your life, having a therapist help support you through making those changes can make you more successful. So that's something to consider. A type of therapy that's used in different therapies is cognitive behavioral therapy. It's referred to as CBT. And it's really about your cognitive thoughts, your behaviors, and your emotions. And you can see here, they're kind of all interrelated. So if you think, well, nobody's called me, nobody cares about me, and negative thoughts like that, it may affect your behavior where you don't reach out to people because you don't think people want to be with you. And then as you're more isolated, your mood is probably going to keep going down, and then you're going to have more negative thoughts. And you can see how these are interconnected. The good thing about this is that it can teach you, first of all, to identify negative thoughts, but also then you could learn that you could just change your behavior. So I often tell people, if you're not feeling good, turn on some really good music that you like. Music has a way of pulling us into a certain mood, and that could help you get out of a bad mood. You may just change the room you're in or change what activity you're doing, and that could naturally kind of help shift your mood and thoughts. You also can obviously intervene with your changing your thoughts or trying to change your mood and outlook. So as the COVID vaccination has improved and things are a little safer, I think certainly it's safer to do outdoor exercises still, but you can even do indoor things if they're limited with the number of attendees and it's large rooms and good ventilation. You kind of have to just look at these different things, but there's a lot of opportunities to get out there and kind of connect a bit more with people. um, Power Over Parkinson's is an organization in our area that has been doing outdoor activities and various gym exercise classes. That's very good to do. So just at this point, I just want to check in and see if there's any questions about anything we've discussed so far.
Yes,
Oops,
Sarah, we got
excuse me, sorry.
one. Oh,
Mhm.
that's okay. We got
That's okay,
one
I'm
part.
just going back.
Take your time. It's okay. The one we got from the audience, we got one about getting more involved. It says, before Parkinson's disease, I was socially active, volunteered deeply, and enjoyed athletic competition. Now I found myself increasingly isolated. What is what is a reasonable expectation? How can I re-involve?
Mhm. I think that's a great question, and we're all kind of dealing with that with people with Parkinson's or people without even. We've we had the huge shift of kind of hiding in our homes and restricting our social interactions. And now it's sort of like the question is how to kind of gradually reintroduce ourselves and cope with that. Um, I think it's good just to be kind of that awareness and intention of what do I want to try to do first, what feels comfortable, and thinking about those things can be very helpful. I can tell you personally, um, I still feel I can go into places with a mask on, and I still feel anxiety when there's too many people in there, whatever that number is to me. And I think that's going to take a long time to kind of habituate down to where that's a normal experience again. But so I think you can pick activities that kind of ease you into this. I would kind of encourage you to think about exercise and social connection as being key things that would be helpful. Um, but I think a lot of programs like the volunteering, you can check in and see kind of how they're handling that. They might be having fewer people or more assigned slots, but sort of greater distance and things like that that could make it appropriate to go back. So I would try to pick something. I often tell people try to do something like one thing a week and start seeing how it feels for you and what else you want to introduce. And there's some trial and error. I mean, you might go to one thing and then say, I didn't feel comfortable. And you have to kind of decide, do I need to go again and just see if I can get comfortable, or that's not really right for me right now? And either is okay. You just don't want to keep limiting yourself and isolating yourself.
Well, and Sarah, at what point would you recommend, if you, let's say, for example, somebody does try a few things and so, still there's this hesitancy. It's not so much COVID related, it's just this anxiety or kind of apathy, I guess, in some ways,
Mm-hmm.
when would you get somebody, when would you find a profession, when would you suggest somebody find professional help?
Mm-hmm. Yeah, and apathy and anxiety are a little more common in Parkinson's, independent of COVID, but COVID can certainly make that worse. Yeah, I think when you are finding it's hard to do on your own, I would definitely seek help. And also if it's just having a negative consequence, so you want to go, but you're not finding a way to do that, you may need more support and guidance on how to do that. Um, but I would sort of encourage people to reach out for therapists um, earlier. I think most people kind of put that off too. And honestly, it's likely to be very helpful and really help you make the changes you want to make in your life. And I think at this point, with the stressors we have going on in our world, the more help you have, the better. So there's no point in kind of trying to suffer through yourself. There has been a great demand on mental health, so it can be a challenge to find providers. But looking through your insurance in network benefits often have lists of providers, so you can kind of do a search that way. And you can also ask your primary care physicians or other doctors or even people you socialize with if they have people they recommend. So,
That's great advice. Thanks, Sarah.
mhm.
That's all the question I have right now. Do you want to go ahead and
Yeah, I'll continue to the second half, and we'll have time for more questions later. Um, This slide, instead of location, location, location for realtors, I'm going to say exercise, exercise, exercise is our key thing. I'd love to tell you as a neuropsychologist that cognitive activity was the best thing for your brain, but we really know that exercise is actually. So physical exercise programs promote positive and significant effects for any person, but especially patients with Parkinson's disease. And this is some research I wanted to share with you, that there were improvements on global cognitive functioning, processing speed, sustained attention, and mental flexibility. Um, Treadmill training 3 times a week for about an hour over 24 weeks produced larger improvements even. And so attention and speed and mental flexibility are things commonly impacted by Parkinson's. And the exercise can help those cognitive things, but also helps your mood, helps your sleep, and lots of other aspects of your life. Um, so there was a randomized controlled trial, meta-analysis of these types of studies, which means we can look at effects of different activities a little more in detail. And it was over 29 studies, over 2,000 participants. And this was in healthy older adults. And they found that people who exercised about 2.5 to 4 months and had some sort of relative minimal range of intensity 3 times a week experienced modest improvements in attention and processing speed, executive functions, which is a term we use for problem solving, reasoning, sequencing, and more complicated tasks, and memory following aerobic training. And what I will say to you, and that's probably hopefully in the next slides, is that kind of this cardiac, or something that kind of really stresses your cardiac so you're breathing heavy, is the better exercise for cognition. Um, so this shows that brisk walking or jogging helped, and there were greater benefits when you combined aerobic exercise with strength training relative to aerobic only. So Rocksteady Boxing, if you haven't heard of it, is a program that is designed for people with Parkinson's, where they actually do a lot of different activities for stretching, but also mental flexibility, and sort of like punching bags and doing various activities for balance and stability. But it really has a lot of multitasking components. And when I watch this with patients, caregivers would tell me that they saw their loved person's attention and mental flexibility kind of improving with those types of exercises. Um, and aerobic training has been reported to improve cognition in healthy adults, especially for executive, which is another area in Parkinson's that can be negatively impacted. And so I put on here, there's dance for PD. If you don't particularly like some formal exercise programs, there's dancing, which with the music can help produce more fluid movements, but can be a great exercise tool. And then I have a choir image here singing. This is different, but this would be just to help with your articulation and loudness of your voice. We know singing can help people a lot in terms of improving soft voice and difficulties articulating clearly. So overall, exercise has really had positive effects. Another study looked at a lot of different types of exercise. So you could see here qigong, tango, resistance training, yoga, dance, and they actually found that tango was optimal and effective for improving functional mobility in Parkinson's. I would say it wasn't that the other things weren't good. It was just more that probably tango had lots of components to it. So I don't think you have to do tango, but you want to think about things that have strength and flexibility, but also this cardiac component. And so this kind of summarizes that the effort that you put into your exercise is key. So if you can talk easily while exercising, it's probably not enough for your cardiac impact to have healthy brain functioning coming from it. So you really want to do something that's more challenging for your heart rate. I often recommend people try using stationary bikes, because that can be something where you can get your heart rate up, but you don't have risk of falling. Something like that, where you can do interval training, where you can go gradually at first and then speed up, gradually again and then speed up, is often a really good way to kind of exercise your cardiac functioning. For people with apathy or initiation difficulties, that's typically not treated well by antidepressants or medications. but I do have heard from people that going with a caregiver, and going to classes, things that are on the schedule, kind of helps make that a structure and make it a routine. So it's not how do you feel and do you want to go, but sort of this is what's on the cards for today at 10 o'clock or whatever. Um, we all probably do better with classes in that it gives us a structure. We have some expectation that people expect to see us, and that often helps people versus trying to do it at home is hard. And we've probably all experienced that in COVID. It's very hard to just be doing everything on your own. You always mean to exercise, but it rarely happens. So here I have the stationary bike comment. It's a great way to get your heart rate up. If you have more mobility issues, I would consult with a physical therapist about how you can exercise safely. But a lot of people use trekking poles or rolling walkers and other things to help keep them mobile, but also be able to engage in good exercise. So beyond exercise, some leisure activities and are helpful just in terms of your overall functioning. And we found from research that people who had a high engagement in social activities, physical and intellectual, all did better in terms of how they functioned in everyday life. And so they had less functional limitations from their illness or disease. The social part of that is probably because when we're in social settings, we have to think about what to say, we have to listen to what people are saying, and then keep the conversation flowing. And so that can be a great way to kind of keep your attention and focus on a person in the conversation. We've already talked about exercise being great for your brain health and your mood and your sleep. Intellectual type activities, reading, playing cards, and taking classes are all good. I always explain to people that your brain likes novelty. So when you're doing the same thing over and over, that's not really good exercise for your brain. Your brain needs exercise just like your body does. So you need something that's new that challenges it. It's been very hard in COVID to keep up with all these enriched kind of activities. There are ways to do it, but I think it'll be definitely easier as we gradually adjust to doing more things in public. So, so for everyday activities you can do, I think what's really important is that what you do every day can limit symptom expression, improve your quality of life, and optimize your health and wellness. And we don't have research to say that these daily activities actually slow the progression of disease. That's hard to measure, but we know people are less functionally limited by their symptoms when they are more active in these ways. So I do like to talk about cognitive activities because that's my area of interest, but reading is great. And a lot of people tell me they can't read due to attention or visual problems in Parkinson's. And I put the image here of the headphones to say sometimes listening to books on tape can be great because they keep your attention. You don't have to deal with the visual tracking issues, but some of the readers for books are excellent and very entertaining. So that can be a great way to challenge focusing your attention and get to listen to good stories. Um, there's research that shows crossword puzzles that people who did them had healthier cognition over time. And there's nothing special particularly about crossword puzzles. It's more that you want to do something that's challenging to your brain. So Sudoku, visual puzzles, all kinds of things can do that. What you will find is that you get better and better at one, and then when you switch to a different one, you'll be slower and you'll get better and better at that one. And that is your brain exercising, and that's what it should be doing. So it's good to try to mix things up. You know, you may like one more than another, but try to have some variety there. We also, I'll share with you some studies about journaling can be very helpful. It doesn't matter if anyone else can read your handwriting, but just you having that thought process of what you want to put down in paper and expressing it can be very helpful. So I've talked a lot about physical wellness in general, but I think it's important beyond exercise to look at how you're sleeping and your diet. These are areas also that can impact how you feel every day. I always tell patients if they're waking up more than 2 times a night to go to the bathroom, you're not really getting the good rest you need to consolidate your memory. We would like no interruptions of sleep, but 1 or 2 is doable. But I hear people say 4 or 5, and there's no way that that's going to be restorative for you. So it's very important to look at your sleep. That's something to do probably with a clinician, in that the easiest thing is to look at if you have late night liquid intake, to try to limit that a bit to see if it lowers your bathroom calls. Um, but if that doesn't solve the problem, it's good to talk with a clinician, because some medicines that help sleep do have side effects. So you have to kind of find what's best for you in that department. There are a lot of therapies as well, behavioral therapies that therapists can talk to you about to help your sleep. So the other area that I think is good to talk about is that there's a lot of tools that we can use to help ourselves. And this applies to people with Parkinson's and without. So I always tell people the earlier you use these and get them into your routine, the better. So using a calendar, writing things down, we know what we track in terms of exercise or the food we eat definitely helps us do better with goal setting if we want to do that. That would be for like an exercise class, or that's why in certain diet programs they have you track what you're eating. Pill boxes are a very important tool, because I always tell people we really don't remember taking our pills. We take them so many times, we don't have unique memory for that. And so the pill box is the only way you can check and verify that you have taken it correctly. So if you're not in the habit of using one, that's a great tool to have to get used to. And certainly alarms can be helpful to remember midday pills and things. And using, when I say using the environment to cue activities, like I often talk to people about creating kind of a landing pad area where they put their wallet and keys, phone, glasses, and anything else, so that they're not searching the house for those things all the time. So kind of things have a place to go. In Parkinson's, you can have a lot more problems with executive functions and more problem solving. And that's a hard area to target, but I encourage people to allow more time to make decisions, brainstorm ideas, maybe even talk with other people if you tend to get kind of stuck and only see something one way, to try to talk about various ideas or activities that could be possible. And definitely to avoid rushing and impulsiveness, and plan ahead. People with Parkinson's kind of tend to know what certain things are stressful. Like I'll have people tell me if they're going out of town, they know they need to plan many more days in advance than they used to. And so to know that about yourself and then plan for that can help that be less stressful and more successful. Any questions about those various things we talked about?
Well, Sarah, we've got one question about exercise and diet, and I'm just going to read what they wrote. Does exercise and diet mitigate the symptoms of Parkinson's, and can these factors be prescribed?
Well, I love the prescribe part. That's a great, great question. I'm happy to tell you I prescribe it. I'm not a physician, but they are definitely helpful. Um, I guess I'm going to kind of try to explain the term mitigate. So exercise definitely helps Parkinson's, and like I said, you will feel more, you'll have more functional ability or less symptoms. It doesn't mean it's changing the course of your disease necessarily, but it's definitely helping you in your day-to-day life feel better. So I guess I think you could broadly call that mitigate, but I just want to be clear that we don't know if it changes the course of your illness. But obviously, if you're functioning better every day, you're going to do more activities that are going to support you doing those activities longer, which is a good thing. Um, Diet is an area I'm not an expert in at all, but that's a big area. Some people with Parkinson's do complain about, um, if they take their medicine with protein, that it doesn't impact them well, and they don't get a good effect of the medicine, the Sinemet or carbidopa, levodopa. That doesn't occur in every person, but there are things like that that some people deal with and have to kind of navigate around, where they may eat earlier to then take the medicine at a set time and have an emptier stomach and not have that interaction. Um, I don't have any specific diet that I would uh, prescribe, but I will tell you that generally you want to, of course, um, do healthy fruits and vegetables. Try to limit kind of processed food. One thing I've noticed with eating out less, the portions are very large when you eat out, so it's you probably have a healthier diet if you eat at home. Um, but I don't prescribe certainly any one diet. I think balance is key. There's a lot of good evidence for the Mediterranean diet in terms of brain health. But I have to say, people in the Mediterranean also walk everywhere and don't drive. So there might be other things going on in terms of that being a great, healthy lifestyle. Um, I tend not to favor sort of trying to cut out whole groups of a food or category, but more having a good balance. Um, and if you have more specific needs, I would work with a nutritionist or a person, in your medical team that can help you more address your specific symptoms. But certainly healthy foods are good. And um, just paying attention to how it interacts with your medicine could be helpful too.
And Sarah, I had a question that was more for, I guess, a curiosity as a care partner.
Hmm.
Um, uh, with regards to cueing, to
Hmm.
cue for behavior, can you talk a little bit about how, as a care partner, I could assist in cueing for, like, providing a reminder for, a particular action or
Hmm.
whatnot versus being a nag?
Yes, that's hard. Yeah. Yeah, that's a good conversation to have, and I think it's one to have repeatedly because needs change over time. Um, so I think maybe one of the first things would be to first have a conversation. Let's say it's about pills, to say, what do you think could be helpful to take your pills? I've had caregivers make a chart because sometimes when it's another object, that kind of separates you asking, have you taken the pill? So it's on the chart if you did or didn't, and that can be a little easier to um, accept. Um, or different ways to kind of see what's helpful. Um, one question could be, if you haven't taken it by so many minutes of the time that's expected, is it okay if I ask you if you've taken it? Or would you rather have like a reminder? Sometimes caregivers have to set the reminder on a phone, but would you rather have something go off that you have to manage it? Um, and so it really is a dialogue of what could be helpful. Um, some things aren't issues, and aren't a challenge, and then other things can be big issues, and I think this is something that you would talk about over time through the course of illness because needs change. But I think having that schedule and committing to it and trying to kind of both say, well, these are the exercise class times you're going to go to, um, and asking how you can help support that is very important to do in a loving way. But yeah.
Yeah. And
Mhm.
and I'm guessing you would also recommend, if there's something that's particularly difficult to address, in open communication between
Mhm.
whatever partner, whether it's family member and, a son or daughter and a parent versus a spouse, etc., that you would recommend having somebody seeking professional
Mhm.
assistance with that.
Yeah, and I think often having a third person helps you both kind of think of different ways of handling it. And some of these things come up and you have no education of how to manage them. So I think that's perfectly reasonable. And some family dynamics are much harder to deal with than others, so it just really varies. But I do think it's great to talk with another person. That's one thing I notice in my clinic is me bringing all these things up, like how do you do medicines, how do you do this, and then in feedback, what I might recommend gets people talking about it. So it's just like what needs to change. One thing I will say that I routinely say in my clinic is that management of medicines and finances are the two big areas where little mistakes could cause big problems. And in Parkinson's, because of the attention lapses and the visual spatial challenges and the memory or executive, those two areas definitely can have small mishaps. And when caregivers come in and tell me, well, they're doing their own meds and I take care of something else, I'm like, that's like the one thing we don't really want to hear. We would much rather have two pairs of eyes, on meds and finances. Even if there aren't problems, the only way you'll know there are problems if somebody is checking that. Otherwise, you get negative feedback like a late fee or something else. But if you're taking your meds wrong, that can have serious impacts on your health. So we know that perfectly healthy people make mistakes taking medicine. So there's nothing negative about saying two people should check this regularly. Sometimes that means once a month. Sometimes that means every time the pill box is filled. Um, and some couples, filling out the pill box is a big challenge. So the caregiver does that, but the patient can manage taking their pills alone. So it can vary what people are doing, but I think those two areas are big things to talk about together. Yeah. All
Great.
right. Let me go a little bit further. We have a little more time, but this last part, I just want to share with you that we've done some studies of behavioral types of therapies that have been helpful for people with Parkinson's and caregivers. So I had a student, Therese Cash, who was very interested in mindfulness, and we did a 8-week program where people learned mindfulness techniques. And we had 29 patients and 10 caregivers complete this. And we looked at depression, anxiety, and apathy, but also cognitive variables to see how this helped people. And all the groups, patients and caregivers, had improvement in depression and a personal sense of improved language skills, which was a little unexpected. And then patients improved in mental flexibility and PD-related quality of life, specifically cognitive and emotional functioning, which was great to see. So this is without medicine, no side effects, just coming to do a mindfulness class 1.5 hours once a week for 8 weeks. So that's a great tool to use. Expressive writing has been used in psychological research to help with people with trauma history. And so we looked at traumatic versus neutral events that people wrote about. And this was just in 3 writing sessions over 2 weeks. So they did 20-minute writing sessions 3 times in 2 weeks. And we looked at patients and caregivers. And we also looked at a number of outcomes, cognitive, emotional, and cortisol, which is a stress hormone to look at. And we followed them up to 10 months. And what was really interesting, first of all, is that very few people wrote about Parkinson's as their big event to be processing. Most people were dealing with everyday life events that you deal with, family issues, deaths, life-threatening events, illnesses of people, things like that. Both patients and caregivers had improved learning and memory skills and reduced anxiety. And there were also trends for improved mental flexibility, depression, and less caregiver burden. So those were great to see. And again, this is with no drug impact. So that's great. So it is important to really think about, and I want to encourage you to kind of brainstorm, how do you cultivate joy and happiness? And, it's often in everyday moments, quiet moments that are very restorative for us. So there's a lot of research about practicing gratitude and actually writing out or stating what you're grateful for to help build resilience. And when we focus on joy rather than being anxious about what could happen, we're kind of building resilience and cultivating hope. And so this is really a practice. You can build resilience as a practice. For some people, it's a spiritual practice, and it does kind of relate to human connectedness. So I did want to I liked this researcher that talked about hope being learned, and it's plan B. And there's a trilogy of hope. You have goals for the future, you have pathways where you want to focus your energy, and a sense of agency, or that you can do things. And so even when you're thinking, I can't do whatever it is anymore, I hear people tell me all the time, I can't run, I can't garden, I can't golf, I can't do these various activities I like to do, is trying to think of other ways you can enjoy things. They could be related or totally unrelated. And I do encourage people to try new things so that you're not just giving up activities and losing hope. The creative process is a wonderful thing to explore, but it helps us accept non-perfection. It can be something you think I'm not good at, but that's a great thing to try for your mental health, in terms of trying something new and different and seeing what it is for you. So music is a great tool. We've already talked about helping improve your mood, but also art is great. Um, and I really emphasize to think of your kind of coping as a toolbox, and that you have different things that you do for it, and they may change over time. And there is a bit of trial and error, but you really want to have more than one thing and not be just taking things out of your toolbox. A lot of people have that tendency after diagnosis and retirement, and it can be a very negative process where you feel like you're losing hope. I encourage people to really think about living with Parkinson's as a marathon. It's not reactive at that first time when you get your diagnosis in kind of a sprint mode, but more where you want to think about having a team that helps you, your physicians, but also maybe social groups or exercise groups that you do. You want it to be something that's sustainable and that can change over time. So, as we kind of wrap up, I encourage you to think about, what strategies would you like to try first? Just pick a few, try different strategies. And you can try strategies, it's called habit stacking, where you, let's say you always um, uh, eat your breakfast and then read the newspaper. Well, you could add something to that routine. So you could say, then I'm going to go for a walk, or then I'm going to go to an exercise class, or whatever. So you kind of are just linking other activities to a habit you already have. And some people do best with just focusing on one challenge or problem at a time. Um, but I really think it's important to remember that you can improve both your thinking skills and mood by engaging in cognitive stimulating activities, and everyday behaviors can reduce your functional impact of your symptoms, and also just make you have a better quality of life in every moment. So that's a win-win situation. As you think about what you would like to do, I'd like you to reflect on what we talked about today, was making sure you have good cognitive exercise for your brain, social connection at whatever level feels appropriate to you, and some physical fitness and exercise. So I know that's a lot of information, but if there's any other questions, I'm happy to take them.
Thank you so much, Sarah. There's so many great, nuggets in there. I think both for people with Parkinson's, but also for the care partners and family members who are caring for those that have Parkinson's. And yeah, Carl wanted me to ask, what was the one thing that you would, out of all this tremendously great information, that would be the take home message that we would want to leave folks with today?
I think that would be really that what you do every day has great impact on how you feel. And so, if you're sitting a lot, or you're not interacting with others, that's going to have some negative consequences, but you have direct control over what you do every day. And that, hopefully this talk has given you some ideas of how you can brainstorm ways to be a little more active. Um, and then look at that triad, the physical, social, and exercise. And often those things can be kind of combined. So you could go to an exercise class and have a social interaction. I think rock steady boxing is very good for that. Um, but take some ownership of that. When you go to the physician and they give you a pill, that helps, but it is not going to have the impact of what you do every day has a tremendous role. And that's something that if you're not really taking advantage of, you're definitely missing out on some great possibilities there for quality of life. So
Excellent, Sarah. Thank you so much for all the gems you have given us today. And we really do appreciate you taking time out of your schedule to give us these things, these tools, more tools in the toolbox for everyone to
good.
think about as they're living well with Parkinson's. So thank you again.
Thanks for having me. It was wonderful. Thank
So
you.